Yes.
Yes, all dah kenyang perut. Okay, right. We will start with the lecture. Okay, so today's lecture will be on the drugs acting on central nervous system. Okay. Again, always got problem. Hang on a minute. Yeah. Okay, I'll put it. Slideshow. Okay. So the learning objectives, of this lecture. So at the end of the lecture, students should be able to list or give examples of drugs that act on central nervous system. Okay. Be able to describe the mechanism of action of drugs and their pharmacological effects. Be able to explain, how drugs are relevant in clinical medicine. Okay. So basically, for any lecture, any drugs, any system, any drugs that act on any system, you should be able to know, the basic anatomy and the physiology. That's why usually physiology, and anatomy, you take it in first year and second year, so that you have the basic knowledge before you know how drug acts on these organs. Okay. So I'm not going to go through this basic knowledge and physiology. You have to refer to your notes, and the introduction, I will introduce to this topic, the central nervous system, and drugs acting on CNS. There are a few groups, but today's lecture will only cover on anticonvulsant drugs and CNS stimulants. Okay, and on tranquilizers, neuroleptics, sedatives, and opioids will be covered by Dr. Ubaid. So he'll be coming in tomorrow, for the next week. So he will take lectures on these topics and also on general anesthesia and local anesthesia. Okay. So drugs can alter the function of CNS, to provide these are the effects, when drugs act on CNS, they can produce anticonvulsant effect, tranquilization, so like you're sedated, analgesia, reduced pain, and also anesthesia. Okay, so drugs that cross blood-brain barrier, mostly they are lipid soluble, they're small in molecular size, they are poorly bound to protein, so the protein, plasma protein bound is very low, okay. And then the non-ionized, they are non-ionized at the pH of the cerebral fluid. Okay, the blood-brain barrier tends to increase in permeability in the presence of inflammation or at the site of tumors. So if there's something not right with the brain, so the blood-brain barrier, will increase in the permeability. That means it will allow, drugs, to enter, to the target receptors. So the blood-brain barrier, is poorly developed in neonates. Therefore, drugs, or any chemicals can easily get access to neonates. So we must be very careful when you give drugs to young or very young animals. because the liver not very well developed, kidney, and also the blood-brain barrier. Okay, so the dose will be adjusted for neonates. So the anticonvulsant drugs, yeah, there are very few available, yeah, for human use, and also not many lah for veterinary use, but some of the human formulation, yeah, has been proven to be clinically useful in dogs and cats. Tapi mainly the anticonvulsant drugs, yeah, in veterinary practice are licensed or being what do you call registered, yeah, for the use in dogs, yeah, not not many in cats. Sometimes we extrapolate the dose, yeah, of dogs, yeah, to cats. Okay, so mainly they are available for dogs. So some of these drugs they are rapidly metabolized, yeah, in dogs to be effective, even at very high doses. Okay, but very little apa ni clinical experience, yeah, or this clinical usage of these drugs in cats. So these cats are generally assumed to metabolize these drugs more slowly, yeah, and poorly as compared to dogs. So this is the general mechanism of action of anticonvulsant drugs. Yeah, mainly they affect the neuronal membranes. They can act directly or indirectly. Directly on the ion channels, okay, on the ion channels, resulting in the hyperpolarization of the neuronal membrane. So, do you remember your physiology on hyperpolarization?
Yes.
Yes. So, when do you get uh, hyper hyperpolarization? And when does it happen? Can you remember your action potential?
Yes.
Yes. So usually after the depolarization, yeah, it will go to a peak, yeah, and repolarization will happen, and followed by hyperpolarization. Okay, I hope you all can remember the action potential of the cell membrane. Okay, and then indirectly, yeah, it activates the GABA-gated chloride channels, yeah, increasing the frequency of chloride channel, yeah, opening that produced by GABA. So this will allow the chloride anions to pass, yeah, therefore causing hyperpolarization of the neurons. Okay, so this can be direct or indirect. Right, the therapeutic uses. Okay, anticonvulsant drugs, yeah, number one, they reduce the incidence of seizures, the severity of seizures, the duration of seizures. Okay, so you understand, incident, yeah, the happening of the seizure, severity, yeah, severity, we can classify seizures into like mild, moderate, and severe, yeah, and duration, yeah, how long, it happens. Okay, so the adverse effects, okay, seizures or a status epilepticus, yeah, may follow rapid cessation of administration of these drugs. Yeah, if like suddenly stop, yeah, the use of these drugs, yeah, it can lead to status epilepticus or seizures. Okay, status epilepticus, it refers to a condition where a seizure lasts for longer than 5 minutes, yeah, continuous. So that is status epilepticus. Okay, or when the seizure occurs, yeah, very close, apa ni, close together. I mean, one after another, one attack, and then after that, it comes again and again. So that could be referred as status epilepticus too. Okay, and then usually between the first seizure and the second seizure, yeah, the attack, the person or the animal is not awake, it's unconscious. Okay, so enzyme induction, yeah, so alkaline phosphatase can be induced, yeah, from, so actually it's a liver enzyme, yeah, can be leading to increase in serum. So there you will see the rise of alkaline phosphatase in blood. Hepatotoxicity, yeah, develops in 6 to 15% dogs treated with primidone, yeah, alone or in combination with phenytoin. Okay, so these are drugs that use for the treatment of convulsions. So let's look at the drugs. Yeah, the group of drugs. Yeah, are used as anticonvulsants. First group would be the barbiturates. Okay, so barbiturate we have here phenobarbital. Okay, so phenobarbital is an oxybarbiturate. Yeah, there's an oxygen molecule attached to this drug. So it's unique, yeah, in that it usually produces the effect at low doses, yeah, than those necessary to cause CNS depression. Okay, so it's very effective. So usually for long-term use, yeah, clinician will prescribe, yeah, phenobarbital. Okay, for 6 months, yeah, even like for a year and so. But they won't prescribe for the entire year. Okay, they will ask to come back after a month or 2 or 3 months. You know, to give stock to the client, yeah, so that they can administer to their dogs with seizures. Okay. So we have this in the pharmacy. So drugs that are available in our pharmacy and being used in University Veterinary Hospital, you must remember, you must know. Okay, the other drugs, yeah, there are many drugs lah, you know, but those that we use, you know, at least you know, and then when you go to your final year, fourth or final year, you will see them, and then you know, you can recall, you will remember better. Okay, so this drug is available, and the therapeutic uses. So phenobarbital is used for long-term control of seizures. It is administered orally, so it comes in the tablet form. Yeah. So easy for the client to administer to their patients, especially dogs. So it is not useful for terminating an ongoing seizure. Okay, why? Because the onset of the effect is too long. Okay, so it only takes about 20 minutes, yeah, uh, to get the effect. So if an animal is suffering from seizure, you can't give this lah, definitely, because it's in oral. Yeah, firstly it's in oral form. Yeah, you don't want to choke the animal. Yeah, you don't want to put it in the mouth, and then you can just go into the larynx and into the lungs. Yeah, and then secondly, yeah, the effect is only after 20 minutes. Okay, so it's not it's not ideal. It's not the drug for ongoing seizures. And then the peak levels occur, yeah, in the 4 to 8 hours, yeah, after oral dosing in dogs. Okay. So the adverse effects, yeah, of this drug, sedation, yeah, but they will overcome the sedative effect lah within 1 or 2 weeks. Yeah, they'll be okay already. Okay, they will develop tolerance to the sedative effect after 1 or 2 weeks. So at the first time, you know, they feel like slightly sedated. The animal will be quiet. You know, so you can explain this to the uh, clients. Yeah, so tell them that, you know, this is the effect, but after 1 or 2 weeks, you know, it will just fade away. So the other effects would be like polydipsia, polyuria, polyphagia. Yeah. So what is polydipsia? Anyone?
Excessive thirst.
Yeah. So like drinking a lot of water, yeah, polyuria, yeah, excessive urination, polyphagia. Anyone?
Is it it's extreme hunger?
Yeah, excessive, yeah. Asyik nak makan aja. So that's polyphagia, yeah. Okay. So pentobarbital. Okay. Right, this is an oxybarbiturate, yeah. So pentobarbital, yeah, will terminate seizures at the dose that produces anesthesia. Okay, so it will take to the anesthetic plane. So the animal will be unconscious, yeah, even though the seizures stop, it will be unconscious. So this dose usually results in significant cardiopulmonary depression, right? But maybe the only way to control status epilepticus, which prolong seizure, yeah, this would be the drug of choice. It has got a rapid onset, yeah, within 1 minute, yeah. It produces the effect, okay, after IV injection. So it's given the as injection and has a short duration of action. So the drug, yeah, that normally we use is Nembutal, yeah, Nembutal sodium solution. So this is the trade name, and it contains pentobarbital sodium injection. Okay, so the dose is 50 milligram per ml, right? So it's a CNS depressant, yeah. So irritating when administered perivascular, right? So if it goes out the vein, yeah, it can cause necrosis to the surrounding tissues. Okay, it's sloughing of skin and so on. So must be very careful, yeah. This drug, yeah, has to be given, yeah, intravenous into the vein straight away, yeah. You must be careful. You must make sure that your needle is in the vein. Okay, so what is the difference? Somebody told me that this drug also being, yeah, I think the previous lecture, I can't remember which lecture was that. We talk about euthanasia, remember? Yeah, euthanasia, dolital. And someone, I asked the class, so what is the active ingredient of dolital? Someone told me it is pentobarbital. Is that right?
Yes.
Yes. So what's the difference between this and dolital, nembutal and dolital? One is nembutal. This is nembutal, yeah, for convulsions, yeah, and it also can be used as GA, yeah, general anesthetic agent. The other one, dolital, is for euthanasia, yeah, but both has pentobarbital. So what's the difference? Both ingredients are same. Anyone?
Street name?
Hello? The name?
Trade name.
Trade name, betul lah. Sebab itulah some like for the use of GA or as anticonvulsants, the trade name is Nembutal sodium, okay, solution. The other one is Dolital, but both contain pentobarbital. So can I like use Dolital instead of Nembutal?
Cannot, doctor. The concentration is different.
The
Concentration.
Yes, concentration. So what's the concentration of dolital? Or what would be the concentration of, if you don't know the exact one, so can you just roughly tell me what, as compared to nembutal, what would be the concentration of dolital?
200 mg.
200 mg, it's very high, high concentration of the drug, yeah, in 1 ml, whereas nembutal is only like 50. Okay, it's a highly concentrated drug. Okay, so with dolital, yeah, you only need like 1 or 1.5 to euthanize a cat, yeah, a cat that's weighing like 3 to 5 kilos. So it has got very high concentration of the drug, whereas this is very low, 4 times lower than Dolital. Okay, so please be careful when you mention like pentobarbital. Can also be used for as a euthanasia drug and also for a treatment, but the difference is according to the concentration of the active ingredient. Okay, so the next drug, phenytoin. Phenytoin, it's not a very popular drug. It's we have this drug, I think mainly this used in the human medicine. It's derived from hydroxytyrosine derivative. It's the anticonvulsant drug. However, the because of its short elimination half-life, in dogs, we don't use this in veterinary practice. It's not a very popular drug. Okay, the next group, okay, benzodiazepines. Okay, you must know, this group of drugs. Okay, so diazepam, it's being used as anticonvulsant. They're also a muscle relaxant and tranquilizer. So in cats, it is administered, orally for seizure control without developing tolerance. In dogs, it is administered, for intravenous for the control of status epilepticus and also seizure control. Okay, right. So these are the drugs. If you see this, you will know. Okay, can be used for muscle relaxant, tranquilizer, or also as a anticonvulsant. The tablet form, Okay, this is the injectable form. Okay, the next drug, midazolam. Okay, so this one is used as anticonvulsant, for status epilepticus, muscle relaxant, and also tranquilizer. The pharmacokinetics, it has a very short elimination, elimination half-life, in dogs. It's about 77 minutes, it's more than an hour, an hour and 70 minutes, so which is shorter, than diazepam. Diazepam has got about 3 hours, in comparison. So they readily crosses the blood-brain barrier. Okay, so this is midazolam, concentration 5 milligram per ml. All right, so this is a 10 milligram vial. Okay, next group of drug, benzodiazepines. We had barbiturate, and this is gabapentin. Okay, so this is a synthetic GABA analog. Okay, remember the mechanism on the GABA voltage channels. So this is a synthetic analog that crosses the blood-brain barrier. To exert its anticonvulsant effect. So this one acts indirectly. Okay. So the GABA content in the neurons are increased, by gabapentin. So, however, the main effect of gabapentin is due to inhibition of the voltage-dependent calcium channels, to decrease the neuronal calcium levels, therefore inhibiting the excitatory neurotransmitter such as glutamate. Okay, it inhibits the glutamate release. Okay, so this is gabapentin. The therapeutic uses, okay, it is useful as an adjunctive therapy for refractory or complex partial seizures. Okay, so refractory seizures, it refers to like cannot control the seizure, yeah, or it could be due to like drug resistant epilepsy. For example, you know, the animal has been long on phenobarbital, yeah, tablets, so it doesn't work anymore, yeah, it's getting seizures frequently. So this could be the alternative, okay, for apa ni lah, for refractory seizures, because it's already like got tolerance towards the drug that has been used for a long time. Okay, so okay, so it's given orally, yeah. So adverse effects, sedation, ataxia, okay, mild polyphagia are common side effects. So abrupt discontinuation of gabapentin may cause seizures. So any drug, any anticonvulsant drug, yeah, you cannot like suddenly stop the medication, yeah. Okay, slowly, okay, you have to see the progress of the animal, okay, before you discontinue. Okay, another drug would be levetiracetam. Okay, the trade name is known as Keppra. Okay, some people just call it Keppra because it's easy, easy to pronounce. But that is the trade name. But the active ingredient is levetiracetam. Okay, so it is used orally, yeah, as a adjunctive therapy for refractory canine epilepsy. So similar to gabapentin. So if usually many of the clinics or in many of the practitioners, they always prescribe what do you call phenobarbital. Okay, that's like the first line of drug for epilepsy. But if the animal has developed tolerance towards these drugs, yeah, the barbiturate group, then you can switch to gabapentin or Keppra. Okay, so please bear in mind these drugs are available in our pharmacy. Okay, so when you go to fourth and finally, please remember these drugs because Dr. Intan, yeah, Intan Fatiha, yeah, she would teach diseases on this CNS and so on. And she always claimed that students, you know, they forget, you know, what they learn in third year. Drugs like gabapentin, when she mentioned gabapentin, Keppra, you know, they cannot recall. So please, I'm telling you whatever, you know, I show you in today's lecture. So all these drugs are available in our pharmacy, and you must know. Okay, these are the things that must know. If you want to get more information about other anticonvulsant drugs, they are available in books. Okay, you can read them. So these are things that you need to know. So this one being used as for adjunctive therapy, yeah, for refractory canine epilepsy. So well tolerated in dogs, yeah. So it can be used also in cats, but you have to like adjust the dose lah. Okay. And the mechanism of action, it inhibits hypersynchronization of epileptiform, yeah, burst firing. So hypersynchronization, so it comes from the word like hyper synchronous. Okay, this is referring to the activity, yeah, epilepsy activity, yeah, yeah, hypersynchronization of epileptiform is actually epilepsy lah, a form of epilepsy, yeah. Burst firing, I mean like, because this is referring to the electrographic activity, yeah, that's apa ni, charges and so on, yeah, during seizures, yeah, increase in the electrographic activity, yeah, which, you know, cause the firing and the continuation of the seizure activity. Okay, so it binds to the synaptic vessel protein 2A, yeah, in the neuron. So this interaction, yeah, with the drug interaction, the drug with the vessel, the neuronal vessel protein 2A, yeah, may account to the anticonvulsant effect. So the binding of the drug to the protein 2A, the neuron produces the anticonvulsant effect. Okay, the adverse effects, it's got very little adverse effects, yeah. So which may include changes in behavior, yeah, drowsiness, yeah, GI disturbance. So this is common. No, any drug you take, you will get slight GI disturbance, yeah, like vomiting, diarrhea, anorexia. This is very common lah, but not to worry about this effects. And then the withdrawal of this drug should be slow, yeah, to prevent withdrawal seizures. Okay, so you have to like slowly withdraw the drug, yeah, with animals that are given for a long time, yeah, to control seizures. So it comes with the trade name of Capra. Okay, Capra. So this one is like senang nak sebut lah. So anybody in the clinics usually they don't say the generic name, but they always say Capra. It's very easy to pronounce. So 500 milligram. There are high doses also, like 1000 milligram and so on. Different doses of this drug. Okay, it's a film coated drug and it contains levetiracetam. Okay, so as you can see here, also when it's in the caplet form, yeah. So when there is a line in the middle, that means you can cut into half. Okay, so if the animal requires like 250 milligram, yeah, just cut the tablet, yeah, into half. Okay, so on the that's on the anticonvulsant drugs, yeah. So those are the things that you need to know, yeah, whether you like it or not. You must know because these are the common ones used in our practice. Okay, we move on to CNS stimulants. Okay, so CNS stimulants, they are referred as analeptics. Okay, so the most common one, yeah, is doxapram. So it's being used as a CNS stimulant. Yeah, the other one, yeah, the others were like CNS depression. They depress the CNS. Yeah, this is will stimulate the CNS. So the mechanism of action, yeah, it stimulates the respiration, which is a result of direct stimulation of the medullary respiratory centers, yeah, through the activation, yeah, of the carotid and aortic chemoreceptors. Right. So what are the uses? So it's used to arouse animals from anesthesia. Okay, so from either when you give like as inhalant or parenteral. Okay, parenteral means, I've explained this before. So it bypasses the gastrointestinal tract. It's either given IM or IV, as subcut. So it wakes animals, yeah, from anesthesia, yeah, or it can be given as an anesthetic overdose when there's an anesthetic overdose, yeah. So doxapram can be given to reduce the or to counteract the action of a CNS depression drug. Okay, because it works the opposite. Okay, so the depth of the anesthesia is reduced, yeah. Then but the effect could be transient. So therefore sometimes you need to you can increase, it depending individual variation in animals cats and dogs, and you give like a agent that can have effect on the CNS. You must always you will calculate the dose, but you don't give it the dose all in one go, okay, because sometimes maybe 1/3 of the dose is already in the anesthesia plane, okay, can perform surgery and so on. So it is depending on the individual. Okay, so you see, or how do you measure whether it's already unconscious or not? There are some signs that you see, the dilatation of the pupils, and then you pinch the web of the cats or dogs in between their toes. You just pinch there, and then there are a few signs that you look for, okay, to know whether the animal is already anesthetized or not. Okay, all this I think will be taught when you take the course on anesthesiology. And so this drug is used for respiratory as a respiratory stimulation in neonates after assisted birth or cesarean section. Okay, so doxaprem is used as a stimulatory drug in animals. Okay, so the adverse effects of this drug. Okay, high doses, okay, may induce seizures, okay, hypertension, arrhythmias, and hyperventilation leading to respiratory alkalosis. So hypertension, is increase in the blood pressure, can alter the rhythm of the heartbeat, and then it can also cause hyperventilation. Okay, this is doxaprem, it's injectable form. Okay, so any questions so far?
Doctor, I have a question.
Mm-hmm.
Doctor, can you hear me?
Yes.
So, for example, if a cat or a dog is seizuring, right?
Uh-huh.
And then most of the anticonvulsant drugs have similar effects. So, how do we decide which drug to use?
Okay, so some are in oral form and some are in IV form. Okay, so pardon?
No, I'm listening now. Sorry.
Some are in the oral formulation, some are given, some are prepared as for intravenous formulation. So which one would you decide when the animal is having convulsions? Which one would you go for?
IV.
Definitely, because you want the immediate effect, isn't it? You don't want the animal to have seizures for 5 minutes or 10 minutes. The animal could die because it won't have swallowing reflex, and then the saliva could just go into the larynx, into the bronchiole, and into the lungs. That could lead to death. So it depends on the severity of the animal. Okay, for seizure control, if the animal is having seizure control, lifelong and so on, you don't want to give IV every day, right? How can you give IV, and how can the animal get warded in the hospital? So definitely you want to give a formulation that the client could administer to the patient, right? So with IV injections, definitely a clinician have to administer. Because clinician has to administer because all these drugs that barbiturates for IV, it's a drug that highly irritant. It cannot go perivascular. So only a vet, who is experienced vet, who knows to inject drug intravenous, would give drugs such as pentobarbital intravenous. For clients, the best thing, for prolonged use, because sometimes these seizures, they won't stop, sometimes they get it like from birth or apa ni, during the years they develop due to some infectious agent or some problem. But those that develop due to some problem, tumors or so on, so you need to give it like for a long time. So usually we prescribe oral medications. It depends on the severity of the condition.
Okay, doctor. Thank you so much, doctor.
Okay, no problem. Any more questions?
Doctor, I have a question.
Mm-hmm.
Okay. So for Nembutal, if we give high dosage to the animals, it will cause can cause euthanized effects. I mean,
Of course, yes. Nembutal, you have to give like, wait, where is Nembutal? Here. Nembutal here, the concentration is very low, isn't it? It's 50 only, 50 milligram. But with, you can imagine how much ml you require before you can cause death with Nembutal.
okay.
You got my point? Because Nembutal is very low concentration. It's only like 50 milligram. Each 1 ml, only contains 50 ml. Okay, so each 1 ml 50 milligram lah. So you need for let's say lah, you need like 4 high dose high ml lah, like 200 milligram per ml is Dolital. Okay, you have to give like 4 times higher the dose in order to kill the animal.
Oh. Okay.
So
Thank you, doctor.
so it's never, I mean, we usually seldom people make mistake by giving Nembutal unless you're practicing outside, and you only have Nembutal, you have to give like more mLs lah, 4 times higher than the. But if the animal requires 2 ml of Dolital, which is like if 2 ml means is 400 milligram. So you have to like achieve 400 milligram lah in order to kill the animal. It can kill, but you give like overdose, overdose of Nembutal, you can kill the animal.
Yep.
Any questions? Any questions so far? So okay, so that's about this anticonvulsant drugs, anticonvulsant. Because some of these drugs will be repeated later on in your in the next few lectures, because this pentobarbital gives you general anesthetic effect too. Okay, so when Dr. Ube teach you on the GA and local anesthetic drugs, local is different lah, okay, on general anesthetic drugs, so this is same drugs, will be repeated, okay, but in different contexts lah as a GA. So it won't be like very difficult to memorize, but you need to know lah what are the pharmacological effects. Besides like anticonvulsant, also can be used as a muscle relaxant, and produces anesthetic effect and so on. Okay. So no questions? No, all right then. So tomorrow, tomorrow I think it's Dr. Ube's turn. So actually, he's an anesthesiologist in the hospital. Yeah, he's a clinician. So yeah, he'll be talking on this sedative opioids. All these drugs has got effect on the CNS. Yeah, and he will also talk about general anesthetic drugs, the injectable ones, and also the one that given as inhalant. Okay, and lastly, it will cover on local anesthetic drugs. All right. So these are the topics that will be covered by Dr. Ubed. Yeah, for the next 1 week. One week, yeah, more than a week. Yeah, I think he got about 4 lectures. Yeah. Right. So any questions? If there's none, I will let you off, yeah, for the next lecture. We got lecture of the days? 10 o'clock lecture. The lecture.
Yes, doctor. Yes.
Yes. Okay. So yeah, you got 10 minutes. Yeah, you can just have a break and get ready for the next lecture. Okay, then I shall end the meeting. Hang on a minute. Yeah.